Hi, health advocates. In today's discussion, we will discuss healthcare communication. And even though there is only one meaning, there is actually two perspectives to look at this. It is the professional's perspective, and it's also the layperson's perspective. This video is also followed up from the last video, the healthcare vocabulary video, and I'll make sure to give you a link in the description box below. In this video, I'm going to clarify both. So first, let's cover what it means to the professionals. Now, healthcare communication is the study and practice of communicating health information and education between the professional and the patient. The purpose for professionals to disseminate health information is to influence the patient's health choices by improving their health literacy. Now, healthcare communication is the study and practice of communicating health information and education between the professional and the patient. The purpose for professionals to disseminate health information is to influence the patient's health choices by improving their health literacy. They often do this while they're in the treatment room. However, as we both know, being in the treatment room and being sick, we're not ready to take any notes. And so that's kind of where the disconnect is. But nevertheless, it's in the healthcare professional's environment. Healthcare communication is a unique niche that allows professionals to communicate strategies to inform and influence decisions and actions to improve health. The experts who supply the professionals with this health communication information believe that this communication must be tailored for the professional's community to which they are practicing and the immediate situation in the treatment room between the doctor and patient. Health professionals always seek to refine their communication strategies to continue to inform their patients about ways to enhance health or to avoid specific health risks. I can't emphasize this enough, as this is on the forefront of every health professional's mind, as they always will continue to increase the patient's health knowledge and awareness, influence their behaviors and attitudes towards a health issue, demonstrate healthy practices, demonstrate the benefits of behavior changes, advocate a position on a health issue, increase support, and alleviate misconceptions about health. But these are all things that are geared towards health professionals. However, there's nothing out there for everyday people to learn what they can do to help improve their communication. There are barriers inside the physician's office. We all know that. And needless to say, healthcare communication has become a one-way street. However, communication needs to be a two-way street. And not just in the healthcare industry, of course, but any time we interact with another human being, right? And where this becomes an issue in the healthcare environment, we need to understand that this communication barrier in the healthcare industry, we cannot transition the traditional provider-patient relationship from the parent-child-like role into an equal partnership in which today's patient and provider so desperately need. Now let's uncover the communication of what it means to us, the everyday people. And in this video, I'm going to explain how everyday people can realign their traditional roles and move it into a more modern exchange of information just by understanding the essentials of communication in a health setting. And if we haven't met before, hi, my name is Jennifer, and I am the creator of Patient Better. Welcome to my channel. This channel was created for everyday people like patients, families, and caregivers to learn how to manage care more easily and independently. And if you have your textbooks, go ahead and turn to 1.3 Healthcare Communication. This lesson educates lay people on the importance of healthcare communication in a professional environment. You have a little bit of knowledge before you get to this video. And it emphasizes the focus on the dissemination and the transmission of the information exchanged between the patient and the clinician that will positively influence your personal health choices and play a key component into the improvement of health literacy, which is our next video. Now first, let's define what healthcare communication means to patients. Healthcare communication is the focus on the dissemination and transmission of information that is exchanged between the patient and the clinician to influence health choices and to improve health literacy. Aha! So what about our obstacles? And what do we factor in our decision making? Well, let's face it, it's everyday life, right? Things happen. It's the technology and our limitation to understand every single system that comes into our fold. And the last, now we are on a roll just by simply defining healthcare communication and what it means to our perspective, and understanding and taking a closer look at some of the challenges and barriers that we have as patients. Now we can achieve so much more into what goes into healthcare communication in the practice. Now let's go ahead and take a look at our self-management program in Lesson 1.3, Healthcare Communication, and see a little more in detail what we have achieved. Here are some of the obstacles in which we find really challenging to control. Number one is everyday life. Let's face it, we're all busy these days. And then we have technology. Although it has so many conveniences, until we are always connected, there will always be room for improvement. And another barrier is money, or lack thereof it. Until we have an unlimited supply of it, the cost of care will always factor in our decision making. I wanted to share with you some of the positive upgrades that Lucy has made to prepare for her appointment and to get all of her doctors on the same page. First, she always prepares for her appointment. Secondly, she utilizes the Patient Better program, and she contributes her work, meaning that Lucy supplies all of her physicians with the same health story. And she makes sure to jot down in between office visits her chief complaints. How this is done is that Lucy documents all of her concerns in between the office visits as they happen. We will talk more about this later, but here is the anatomy of a chief complaint. Each complaint is segmented into 5 separate parts. Number 1, the primary mention, which is what it actually is, the location, the duration, and the severity of it, and the secondary mention. Now let's bring this all home. Lucy improves her communication skills by first eliminating the obstacles and barriers that might affect her office visit. And the night before, she prepares for an activity-driven, effective medical appointment simply by writing down what is ailing her while she is at home. Now let's connect what we have learned so far and take a look at how Lucy is connecting the office visit with her self-management skills. First, she analyzes the layout of the practice and she categorizes services, products, and finances. Secondly, she matches the right professional to the task, and she determines the roles of each clinical staff. Therefore, she knows that all of her communication is going to go to the right person that can help her out the most. And then thirdly, she classifies all the stressors that are controllable and not controllable, simply by appointment preparation. We've covered a lot in our health communication video. Just to let you know, you are well on your way to become an effective and productive self-manager. And these 2 components, the definition and understanding obstacles and barriers, we are able to have a productive, activity-driven appointment every single time. And what we can achieve simply by defining healthcare communications, obstacles and barriers, we will, number 1, know the best communication practices in a professional environment to prevent and safeguard ourselves against errors. As we said before, this communication program is done by meaningful learning, which means that people are able to take already learned information and now apply it to new. And then we will learn the difference between medical jargon and medical terminology. Now that concludes our video for today, and I want to hear from all of y'all as to what communication blunders you have made and what you would want others to know about your experiences, and put it in the comment section below. Remember, the comment section is created for and by everyday people, so make sure you do not disclose your diagnosis, as we do not support drug and device solicitations or provide any medical advice. But your comments would be so much fun for others to see, and who knows, an onlooker might be a healthcare professional, and they might get to know what's on the forefront of their patient's mind a little more. And thank you, health advocates, for being the absolute best part of Patient Better. Until next time.